And it's been more than a month since we were all thrown into a new way of living and working, and a drastic change like this can really take its toll on your mental health. Now, a big part of the rebound will be dealing with your emotions and feelings. Joining us live right now, 13 Action News anchor Ross DiMattei, who's working from home right now, adjusting like so many others. Ross?
Yeah, Kalina, you can clearly count me amongst the folks who are now working from home. And like so many other people, when you're living a life consumed by quarantine and social distancing, it just seems like the coronavirus is always on the top of our minds. Well, I talked with two experts who actually say that feeling is pretty normal, but what's more important is how we deal with it.
Isolation is a word we hear quite often.
Some clients are unaffected, while other clients are profoundly affected.
It's an avalanche of emotions.
Everybody's upset.
It's just leading to a lot of anxiety.
From clients across the country.
Some of them who are really empathetic to all the loss.
There's a lot of uncertainty.
Mental health experts say the source of all that stress is isolation.
As humans, we are social beings, and I think isolation can be quite concerning.
Especially because isolation can lead you to dark places, like addiction.
The government is asking us to self-isolate, and the fact that that is an attribute of late-stage addiction is a dangerous combination.
The fact is, millions of Americans are turning to the bottle. According to market research firm Nielsen, the booze business is booming during this pandemic, peaking around March 21st when alcohol sales were up 55% compared to the same time last year.
We all need to have a more heightened awareness about the potential for slipping into the cycle of addiction.
David Marlin has been sober for 15 years. He says when it comes to how much alcohol is too much, everyone's different, but we should all be aware of the warning signs.
If your relationship troubles, if you have legal troubles, and it's just being exacerbated by your substance use, then it is a problem. You might be justifying it, and you should keep yourself in check.
So how do we deal with all of this added stress and anxiety in a healthy way? Jessica Hennessy's first suggestion is what's called dialectical behavior therapy, or learning to live in the moment.
Getting fresh air, or using a steamy shower, or putting a cold pack on your head. All those things can serve as distractions to take your mind off of the stressor.
Hennessy says learning to love a new activity like meditation is a healthy way to clear your mind and keep yourself from constantly thinking about COVID-19.
Whether it's cooking, or doing puzzles, or going out for a walk, or making jewelry, whatever it is that gets you going, as long as there's distraction, it takes you away from that pervasive thought.
Both experts agree the best way to cope with coronavirus concerns is to connect and communicate.
Connecting with people beyond work tasks is really important. I think talking about the feelings is important. I think being that it's a collective stress, it's brought a lot to light on how people can cope or compartmentalize those stressors. It just lessens the stigma to be able to talk about it.
Rather than hiding, I could reach out and I could talk to people and try to help them.
And when it comes to communicating, there are so many free resources available to you right here in the Valley. Whether you yourself need some professional help, or you want to help some others cope with our new normal, we have put together an extensive list of resources for you at ktnv.com/rebound. Reporting at home, Ross DiMattei, 13 Action News.